Hi, good afternoon. Thank you for joining. Hi, everybody. I'm so grateful that you're all here with me this afternoon. You'll have to bear with me while I try to figure out Zoom webinars. This is my first one, so we will just make it work. I'm gonna try to share my screen, and I'm gonna need somebody to let me know if they can see it in a second, if you don't mind. All right. Welcome. Thank you again for sharing this afternoon with me. We are going to be talking about why traditional fertility advice just doesn't work. Strategies for a thriving pregnancy. I'm Sarah. I am a doctorally prepared nurse practitioner and functional wellness consultant, and I specialize in fertility optimization. So today you will discover the power of holistic, personalized wellness to transform your fertility journey. I'm going to show you how to move away from persistent fatigue, stress, ineffective conventional health advice that we've all heard, and guide you toward balanced hormones, renewed energy, and a clear path to thriving pregnancy. I'm going to be there with you every step of the way. So stay with me until the end, and you're going to get an exclusive bonus for being here with me as a thank you, as a way to support your thriving pregnancy possibilities. So if you're like me, you probably have 5 or 6 tabs open on your Google or Mac Chrome browser. So shut them off or turn your phone upside down and just be with me here for a couple of moments. The first thing I'd like to do is just do a little exercise, if you don't mind. All right. So we're going to start with a quick and powerful exercise that will show you how easy it is to put some of these tools to use in your busy life. Stress is a major factor for hormonal imbalance and fertility issues, and I like to use something called the 4-7-8 breath to really reduce stress levels, promote relaxation, and support optimal hormones, obviously. The 4-7-8 breathing technique activates your parasympathetic nervous system, or your rest and digest system. This is helping your body move away from a state of stress into a state of calm, which is essential, as we'll go through here in a little bit, for reproduction. By doing this, you will see that you are capable of healing. All right. So if it feels good for you, go ahead and close your eyes and drop your shoulders away from your ears. And we're going to do a deep breath for the count of 4. 3, 4. Hold your breath for a count of 7. 3, 4, 5, 6, 7. And let your breath out through your mouth for a count of 8. 3, 4, 5, 6, 7, 8. We're going to do it one more time. So inhale deeply for a count of 4. 4. Hold your breath for 7, 2, 3, 4, 5, 6, 7, and let your air out slowly for a count of 8. 3, 4, 5, 6, 7. You can open your eyes back up again. And this is a helpful tool anytime you're feeling stressed or overwhelmed. It's a quick and effective way to bring yourself back into your body and out of your head. All right, so I don't know for sure why you're here, but I can make some educated guesses. 1, you might be feeling overwhelmed. You might be curious about holistic wellness, what's so great about it, and if it's so great, why is everybody not doing it? And you might be frustrated, but determined. You've done all the things. You've done all the diets. You've taken all the supplements. You've taken all the tests. And all you've heard is everything looks normal. We don't know what's wrong. But your desire for a healthy pregnancy and a baby is so much stronger than those frustrations. And your intuition is telling you that there's something more. Okay, so which one are you driven but feeling exhausted and overwhelmed by the demands of your professional life? Are you curious about holistic wellness, but I'm not sure if it can help you on your fertility journey? Or are you frustrated by conventional, traditional health advice and you want to know if there's a better way to support your fertility? Let me know in the comments. I'd love to know which one you are. 2 and 3. I love it. Yes. Yeah, I could see how that would be both. Absolutely. No matter which of those 3 resonates with you, please know that I fully support you, and I am so glad that you're here. So I'd like to share a little bit about who I am. My name is Sarah, obviously. I try to make this quick. I have 15 years of healthcare. I was an RN in both acute and critical care for adults and children, experiencing probably the worst days of people's lives with them. In 2017, I became a family nurse practitioner, and I've since worked in a community health center, mostly doing women's health and family planning. And more recently, I am the director of a hepatitis C and HIV treatment program. So when I say I've done it all, I really have. I did a 2-year fellowship in integrative medicine through the Andrew Weil Center of Integrative Medicine. And it was there that I was first introduced to holistic healing and the tools that it can offer people. And I began using those tools in my community health center practice. And it really was a breath of fresh air to be able to offer those things for people. And now I am the owner of Origins Fertility. I am a functional wellness health consultant and coach, and I help women optimize their fertility so that they can get pregnant without having to go through medical interventions or in tandem to medical interventions. So this next piece, I always get a little choked up, so please bear with me. This first photo is 6 days before I experienced my first miscarriage. And it's a bittersweet photo because I don't have any like it with my second miscarriage or with my living daughter. But this little one deserves to be remembered too. I actually don't have any photos of myself in my pregnancy with my daughter because I was too afraid to say anything about it. I didn't even announce my pregnancy to anyone except my close friends and my coworkers until she was born. And I said, oh, here she is. I had a baby. When I say that I can understand the unexplainable grief of miscarriage and fertility challenges, I really can because I lived it too. Several years ago, I found myself on a truly heartbreaking journey of recurrent miscarriages and secondary infertility, a term that I am still confused about. I was reminded with each loss that life and pregnancy are so fragile, but also that things can be fine until they're not. How can you have a healthy child and then all of a sudden you can't get pregnant and keep a pregnancy? Of course, I turned to my OB and my midwife for answers, and instead I was met with these actual statements that came out of my providers' mouths. And mind you, they knew that I was a nurse practitioner, so it felt absolutely condescending and totally lacking empathy. Tell me if they sound familiar to you. There's nothing we can do. These things just happen. I'm sorry, all of your labs look normal. And my favorite, are you taking a prenatal? Make sure you're taking a prenatal and just try again. Despite being an otherwise healthy 31-year-old, the only solution I was offered after some basic labs and an ultrasound was, here's some hormones. You're going to need a trigger shot to induce ovulation. But I had no trouble ovulating because I was able to get pregnant. And there was no investigation recommended other than what they had done. And I felt totally disheartened and confused, to say the least. So in my own search for answers, thank goodness I'm a medical professional and I know how to find out these things. I realized that conventional health advice often overlooks the root cause of infertility. That same conventional health system that up until that point, I had dedicated my life to as a nurse and later on a nurse practitioner. This experience pushed me to explore integrative and functional medicine, how the body works as one instead of separate systems, and how even just one deep root cause can create a plethora of downstream problems, fertility being a major one of them. So transitioning into a functional model, today I realize that functional medicine really is the key to figuring out fertility problems. It has become my passion and my true calling to help other women who are in a similar position, to guide them through their own healing journey so that they can meet their babies on the other end. And my approach feels like it's truly personalized and it addresses your unique health problems so that you can feel good in your pregnancy, but also in your life for a long time to come. So the first thing is I empower driven women to take control of their health I use functional labs to give you precise information and help you make really informed and effective decisions. I maintain the highest standards of integrity. I'm very transparent and ethical in my practices. And I find that the key with functional wellness is it really is all evidence-based and scientifically backed. I approach each client with true compassion and understanding. I am walking this road with you every step of the way. You're never alone when you work with me. And then I tailor my programs to each client's specific needs. Functional labs really allow us to create a truly personal experience so that you're not wasting any time or money on your path to pregnancy. If you can for a moment, just imagine 6 months from now, waking up each day with a sense of calm, free from overwhelm, full of energy and clarity, and feeling the joy of a healthy, thriving pregnancy. Adopting a root cause approach to fertility is probably the single most powerful and strategic way for you to improve your fertility and achieve a healthy pregnancy, overcome burnout, and find a balanced, energized life. The single most powerful strategy that I know. So if you're anything like me, you want to know where we're going. You're not going to take me on a trip without telling me where we're headed, what snacks you're bringing, what the weather's like when we get there. And so if you're type A, follow along. We're going to talk first about why nutrition is not the foundation of fertility, find some secrets for optimizing your nutrient intake, detox techniques for cellular renewal, and then how we can adapt these things so that you can have wellness throughout your life. If you're curious, I'll let you know how you can work with me at the very end. And of course, I'm going to do a live Q&A so we can get all your fertility questions answered. All right, number one, so why nutrition is not the foundation of fertility. The number one thing practitioners and women miss for their fertility is not nutrition, but adrenal health. So your adrenal glands are small glands located on the top of each kidney. And they produce hormones like cortisol and adrenaline. They help you regulate your metabolism and your immune system, your blood pressure, and a host of other things, including your fertility. These little glands help control our stress response. So when stress depletes the function or the cortisol within that system, it can lead to a host of other imbalances. It doesn't matter what you eat, how healthy you eat, it's not going to fix a stress response problem. And that will remain underneath causing issues. Another important aspect of the adrenals is that they produce hormones. So cortisol is a hormone, but so is DHEA, and they come from the same place. And they help to create our other hormones like testosterone and estrogen. No amount of food is going to help boost your testosterone or estrogen in an effective way, the way that fixing your adrenal system will. And then energy regulation. If you are somebody that wakes up tired, is tired at 3 p.m. and you don't know why, you're reaching for coffee at 1 o'clock, it's probably because you have some adrenal imbalance. And again, you can eat a very healthy diet, but it's still not going to help you overcome that adrenal burnout, essentially. So steps to support adrenal health. Number one, do you even have high or low cortisol? Do you know? Testing is so important here. I would rather you not guess because a lot of the things that we can do to help low cortisol will actually worsen high cortisol and vice versa. I do love to use adaptogens. They're very balancing, and it doesn't matter if you have high or low cortisol, you're going to see a balancing effect from it, which is why I have them here so that there's no way that it can further worsen your fertility picture. I really like these two blends. One of them is called HPA Adapt. It's great for that wired and tired feeling. It's good for productivity, energy. So it's great to take in the morning on an empty stomach, on your workday or whatnot. And then Cortisol Manager is another one. They're both by a company called Integrative Therapeutics. This one is really good for just general stress management, but also if you have a hard time sleeping. And it's great to be taken at bedtime. Another important aspect of this is blood sugar balancing. When your sugar goes up or low, your body uses cortisol to help regulate that blood sugar. And so you're going to be burning away your cortisol at a faster rate. So this means not skipping meals, good meal timing. So breakfast, lunch, and dinner. I'm not a fan of intermittent fasting for fertility. I think that it's so important to wake up and have breakfast within an hour or two of waking up. And then sleep. I remember the years when I would live off of 5 hours of sleep a night and it seemed fine, but you really do need a solid 7 hours of sleep. And starting at about 10 p.m., which is when your body does all of that repair and fixing of your system between 10 and midnight. So if you can fall asleep earlier, the better. And then take a nap when you need it. When you're in this burnout phase, your body's telling you that it needs rest to help repair. Other stress reduction techniques, saying no. All the people pleasers and type A personalities in the room, I know you because I am you. It is so hard to not take on too many things and put too much on your plate. But in this season of your life, you have to put yourself first, yourself and your family. You can reframe it like that in your mind, that this is for your family, and it makes it a little easier to say no. But learning to put some boundaries in your work environment, especially, and not letting that spill over into your personal life, is huge. So I told you would walk away with some actionable steps. I want you to pick one of these things and implement it today. Order the supplement, do the stress reduction, go take a nap after this presentation, whatever that's going to be. I want you to pick one now, write it down, and implement. All right, let's talk about Sarah. She's 29 years old. She's a marketing director. She came to me with burnout, low libido. She had a short and light period, which was about 3 days. She is a mother of 2, actually, already. And so she was feeling like she just couldn't be the mother and wife that she wanted to be. So we did some functional testing, and we found out that she had really low cortisol, really high cortisone, which is a picture of long-term stress, as well as low estrogen and low DHEA, like we talked about. These are hormones that we need to ovulate and reproduce effectively. She had a previous miscarriage, and it's no wonder with the low estrogen that she was having, there wasn't a thick enough lining in her uterus for an egg to nestle in there. Estrogen is what helps build that uterine lining up. So these imbalances were definitely impacting her mood, her energy, her overall well-being. We implemented a totally comprehensive adrenal restoration protocol. First, we corrected some nutrient deficiencies using some testing that we did to know exactly what she was low on. Particularly for her and for a lot of people with adrenal problems, it's B5, vitamin B5. It's a very safe vitamin to add in. If you feel like doing that, you can. I usually recommend taking a complex instead of a single B, but specifically with adrenal function, vitamin B5 is depleted quickly. We also improved her meal timing. She was a chronic breakfast skipper, so we worked on ways to conveniently bring breakfast with her to the office, which was a happy medium for us. And additionally, we gave her some HPA axis support, like the adaptogens that we talked about, but also some more specific supplements that were directly going to improve her specific hormone panels. So on the left-hand side of the screen, you can see some of the lab results that I pulled with her. And she felt so much better. Her energy levels were increased. Her libido returned. You should not be 29 years old and have no libido on a regular basis. That is completely unacceptable. Her menstrual cycles normalized. They were about 5 days in length, and she had regular flow, no complaints, no PMS symptoms. And by the 4th month of us working together, I received this message on Instagram that she was pregnant. And she actually has a little baby boy at home today. This was quite a while ago. So by addressing her root cause of her symptoms, we gave her body what it needed, and she was able to regain her fertility, and she didn't have to take hormones. She didn't have to take medications that were going to mess with her system. And the best part is she told me that once she went into postpartum, she actually felt so resilient. And I am a firm believer that it was because we supported her adrenal system beforehand. Okay, if you feel any of these points resonate with you, you're tired and stressed, your cycle is irregular, maybe it's just short, maybe you're just spotting, maybe you have low libido like we talked about, you struggle with your energy levels, or maybe you just want to know ways to balance your hormones, then adrenal health is where you have to start. All right, number 2, why generic fertility advice doesn't work. Secrets to optimizing nutrient intake. If there is one thing you take away from this presentation, let it be this. It doesn't matter what you put into your body if you can't absorb it. Let that sink in. You can eat all the healthy foods you want. You can take all the supplements, but if your gut cannot take those nutrients into your body, it doesn't matter. And here's a quote: for all disease begins in the gut, and I'm a firm believer in this. A healthy gut is the foundation for overall health and well-being. Okay, so why is gut health so important for fertility? So first of all, food sensitivities can contribute to inflammation in the gut. It can lead to leaky gut. It can lead to an overactive immune system. Specifically, I'm thinking here about Hashimoto's or other autoimmune conditions like rheumatoid arthritis, multiple sclerosis, even endometriosis, which we are thinking is actually more of an autoimmune condition nowadays than a reproductive syndrome. And so it's going to be even more important for us to support the immune system in that situation. Your microbiome is essential for eating and managing all of those nutrients and also for your immune function, both of which are crucial for pregnancy. And then your genetics, so your specific genetics that are turned on and off in ideal and not ideal situations. We can take that information and personalize your diet and supplement choices so that you are getting the nutrients that you need for your specific health situation. All right, steps to support gut health. Number one, what is actually going on in there? We don't know what's happening until we test. Buy healing herbs. You can get that parasite cleanse that you saw at the internet, which I don't recommend doing, by the way. You can add in supplements, but if we don't know the actual bugs that are in there or the actual imbalances, you might just be wasting your money and you could actually be harming yourself. The other important thing to consider is that when your gut has been impacted by inflammation for so long, we really have to support it first to seal up that gut lining so that when you do go through a phase where you're ready to get rid of some of that extra bacteria, your body can't just reabsorb that bacteria and those toxins, that they actually get pushed out of your body instead of reabsorbed. We talked about food sensitivities. I like to use food sensitivity testing in my programs just so that we can have a little bit more accurate reflection of what's going on. But a traditional elimination diet works really well too. If you don't know how to do one, I do have some information for you about elimination diets. Feel free to email me. The idea is if a food is causing you symptoms, then don't eat it. If you love it, it's causing you symptoms, which means it's probably causing you inflammation. And right now, while we're trying to fix things for your fertility, it has to go by the wayside. Eventually, it can be added back in once you're in a place of healing. The other thing that's important is mindfulness at mealtime. Chew your food. I said, really chew it. I'm a nurse at heart. I can eat my meal in 10 minutes. I don't know about the rest of you, probably sitting at your computers during lunch to eat. If you're anything like me, turn the computer off, set a timer for at least 20 minutes, and enjoy your meal in peace. It's going to help you chew your food, digest your food better. It's going to help you get into that rest and digest mode so that you can actually absorb the nutrients. Another great tool that I love is to use spore-based probiotics. The brand that I love is Microbiome Labs Mega Spore Probiotic. The reason I like spore-based probiotics is because I don't know if you know this, but regular probiotics only live in your system for about 2 weeks. And then if you're not continuing to take the probiotics, they will die off and all of the benefits that you had will be gone. Spore-based probiotics can actually repopulate your gut so that when you're done with your gut healing, whatever that might look like for you, you're still going to get the benefits. I am a huge proponent of having an end date to all supplements that you're on. You will not find that I'll put you on a supplement and it's something you need to stay on for the rest of your life. And probiotics are one of those things. Another thing I love is fermented foods. I talk about it a lot on Instagram. I try to get it probably 4 days a week. Kefir, or however you say it. Yogurt is okay. Sauerkraut, kimchi I love with breakfast. And those will help just the same way as a spore-based probiotic will to really help your gut microbiome. You can add digestive enzymes with your meals. So if your stool floats, that's a good reason to take a digestive enzyme. It means you're not getting rid of all the fats in your food properly. It's coming out the other end. A really cheap option that I love and I actually use myself is Now Foods. I've also used this one, Thorne BPP, in the past. It's a little more expensive, but it has a stronger potency of enzymes for people that might need them. So again, pick one of these things, buy the supplement, go get the probiotic food, start implementing it today. I've actually started making my own fermented foods, and I was thinking about sharing that with everybody. So let's talk about Brianna next. She is 31 or was 31. She's a registered nurse, And she came to me after a couple of unsuccessful IUIs. She's had 3 total. 2 of them were just unsuccessful, and one of them unfortunately ended in miscarriage. She was having low moods, some weird, strange hives, and actually not very many gut symptoms. Let me pull my notes up on her. Okay, so her tests, she had a couple of red flags. First, she had low iron, which is classic with bacteria in the gut. The concern is, where is the iron going if you're not absorbing it? And we found some bacteria, included H. pylori, which can impact the gut's ability to digest things, but it also leads to things like ulcers, heartburn, diarrhea, stuff like that. Side note, H. pylori has actually been found in vaginal samples of people that have H. pylori in their gut. So if you have an unsuspecting H. pylori infection there, you may in fact have it in your vaginal microbiome as well, and it can be harming sperm. So it really does need to be treated. We also found in her genetic testing that her gene called the COMT gene, or COMT SNP, was impaired, which was probably a lot of the reason for her mood imbalances. She was also really getting rid of her estrogen too fast. And so she was having light periods as a result because her estrogen appeared low, although on her blood work, it didn't look low. She was just getting rid of it quickly, which is another reason why I love these functional tests, because they paint a more complete picture of what's happening with your hormones. We wouldn't have seen that if we would have just done blood work on her. So to address these issues, we put her through something called the 6R protocol. It's a functional medicine protocol that really addresses the gut from a holistic standpoint. It gets rid of things that shouldn't be there. It re-inoculates the gut with things that should be there. It's usually a 4 to 8 week process. We switched her prenatal to one with iron for a short time. And we also added a methylated B complex to support that COMT gene. She opted not to do food sensitivity testing. She did a traditional food sensitivity elimination diet. And unfortunately, she found that coffee was a trigger. It was a sad day for her, but we were able to find some alternatives that she felt sort of filled those shoes. And eventually, we ended up retesting her. We confirmed that the gut issues were totally resolved. She was really glad that she didn't have to take antibiotics to deal with the bacteria. As a result, she definitely had a ton more energy. Her iron level was back to normal, and she felt a lot lighter mood overall. And I just talked with her a little while ago, and she had a 4th IUI, which was successful. And she messaged me to let me know that she was pregnant, and she just had her first ultrasound a couple of weeks ago, and we're just over the moon. I'm so excited for them. It was wonderful to hear that. Okay, if any of these points resonate with you, you've got digestive issues, you've got bloating. Again, with the low energy, that can be a symptom that's associated with so much, but even things like joint pain, despite you having a healthy diet. If you have food sensitivities, if you just want to make sure you're getting all the nutrients from your food that you're actually eating, then focusing on gut health and epigenetics is essential for your fertility. All right, the third and last piece of why generic fertility advice is not effective. We're going to talk about detox techniques and tips for renewing your cellular health. So your body is great at naturally detoxifying. That's its job until it's not. Detoxification plays a crucial role in reducing something called oxidative stress or inflammatory stress on the body, and mitochondrial function, which is our DNA function. It's the energy that our cells need to do all of the tasks in our body. Of course, those are important for our overall health, but definitely important for fertility, most specifically maturing an egg and getting it ready for ovulation. So back to oxidative stress, like I said, it can damage cells, including those very precious eggs, and it can lower your fertility rates. When we bring down the oxidative stress or that inflammatory stress, we can protect our eggs from damage and improve their quality overall. And then mitochondrial function, so mitochondria, the powerhouse of the cell, we all know this, provides energy for all of our cellular activities, including reproduction. Healthy mitochondria are crucial for egg quality and overall energy levels. So, steps to support detoxification. Where does your body need assistance? First step, how do we know? Testing. Do heavy metals need to be removed? Are there some genetic components that maybe we need to personalize your supplements? We wouldn't know this stuff unless we were testing. A tip that everybody can follow, regardless of testing, is to get your bowels moving every single day. Excuse my frankness, but if you're not pooping every day, you need to be. You can add fiber through foods, fruits and vegetables, of course, but if you're still not going, consider adding a supplement, fiber supplement for a short time. You really want something that has both insoluble and soluble fiber so that you're not getting the experience of constipation or diarrhea with fiber supplements. With that, water intake is super important. I know that's next on my list, but hydration is important for keeping all of that stuff lubricated. Believe it or not, deep breathing is really good for constipation. And the reason is when we take a deep breath, our diaphragm massages our liver, and that promotes bile flow, which helps get the colon moving. That's also why digestive bitters are helpful. I like this brand, Gaia Pro. They have a really good digestive bitter, and that helps promote bile flow through the liver as well. A really key piece of cellular health and detoxification is antioxidant support. So antioxidants are going to surround and protect the cells, promote proper DNA, proper egg quality, protect from that inflammatory stress. I think every single person needs to be on some sort of an antioxidant, whether or not you've had testing, if you're trying to get pregnant. My favorite ones are N-acetylcysteine or NAC. I like CoQ10. I do think adding a supplement here is a good idea. I don't use glutathione for everybody, but in some situations that's appropriate as well. Another important piece of detoxification is lymphatic drainage. My favorite way is jumping on one of those little mini trampolines, a rebounder. 10-15 minutes a day is enough to get all that stuff flowing and your drainage really opening up. You can also do massage, self-massage. You can go get a massage. You can get a lymphatic massage. You can also just put your legs up the wall. That's a big trend on TikTok and Instagram lately. You could also dry brush. You won't hear me recommend that because I like to recommend things that I enjoy doing, and I don't make the time for dry brushing. And so I think that's another important piece of this is to find a practitioner that you vibe with, because they're going to tell you the things that they think are best. And then the last thing I would recommend, if you have had fillings and you're not sure if they're metal fillings, is to contact a biologic dentist who can assess you and see if it would be worth taking them out and replacing them with something a little bit more appropriate or less toxic. It really should be done by someone who's been trained to help prevent extra toxins from getting into the body. You can go to this website here and it will give you a directory of dentists that have gone through a special training, and this organization feels that they're appropriate for removal of amalgams or fillings. So this is a little bit different of a question, but which of these are you already doing? And now you have details about why it's beneficial. I would guess that at least 3/4 of you are probably already on an antioxidant. I love that the word has gotten out about that. Almost everyone that I talk to is already taking something like this. Okay. So we'll move on to Elise. She is a financial advisor. She's 33 years old. And she came to me struggling with chronic constipation. She was having some weight gain or trouble losing weight. She was diagnosed with PCOS by her OBGYN. She had some irregular periods as a result, and also acne as a result. We did testing. We used specifically with her something called an organic acids test. It helps to identify things like oxidative stress and mitochondrial dysfunction. And on hers, it showed high levels of both of those, among other things. You can see that she was having trouble methylating, and she did have some toxic exposures as well. We did some repeat serum blood work, and of course, she did have high testosterone that confirmed that. Also, her insulin levels were really high, which is pretty classic with PCOS as well, having insulin resistance. So to address these issues, we put her on a comprehensive protocol. The third phase of that is detoxification. For her, she was really low on antioxidants, like really low. So we did add glutathione with her. We gave her vitamin C, CoQ10. I think I did add NAC as well, actually, to boost her antioxidant levels. She needed a ton of support. She had some genetic stuff going on too that was making it a little harder for that stuff to be absorbed. We gave her digestive bitters, so that she could support her bile flow. She was already really deep into a meditative practice, which I love. I give my clients access to a meditation program when they sign up with me. And so she really took that and ran with it, which I loved to see. Meditation's not for everybody, but she liked it. We also gave her back some minerals. For her, it was zinc and methylated B vitamins. And then I chose to add folinic acid with her instead of folate or folic acid based on some things that we found in her genetics. And as you can see by this check-in form that she mentions here that she was 18 weeks pregnant at the time, baby girl coming soon. She's just about due. I think she's 6 weeks from being due, and she's really excited. She has a little girl at home, so she's excited for her to be a big sister. Detoxification might also include heavy metal removal, but I will not start somebody on a heavy metal removal plan unless they can commit to 3 months of abstinence or pregnancy prevention. I find that it's not safe to do heavy metal removal or chelation, they call it, when you're trying for pregnancy. And there are other practitioners that disagree with me, but I would rather not take the chance. So we did not do that with her. We did support her kidneys in other ways. That's how your body gets rid of heavy metals, is through urine. Overall, she felt a lot better. She wasn't constipated anymore despite being pregnant, which if you've ever been pregnant, you know that is a common side effect with high progesterone. She had improvement in her insulin sensitivity. Her testosterone was improved as a result. Her acne was better. She was able to start managing her weight a little bit. Of course, she focused more on just a holistic, healthy diet once she had that positive pregnancy test. And her cycles had gone a little bit closer to about 35 days per cycle, which was great for her. She was in the low 50s prior to. Okay, so if any of these points resonate with you, miscarriages, huge. Mitochondrial dysfunction is huge with miscarriages. Chronic fatigue, low afternoon energy, especially 3 p.m. energy crashes. If you're dealing with joint pain, muscle weakness, you have a hard time exercising, you have to stop, you feel like you should be able to do more than you do, you have brain fog, you can't remember things, you're forgetful. Headaches is common, especially in the evening. That's also a really common symptom with adrenal dysfunction as well as evening headaches. Frequent infections, getting sick all the time. You come in contact with someone and the next day you're coughing or you have a runny nose, irregular periods, skin issues like acne or eczema. Then optimizing your detoxification is essential for your fertility as well. Okay, so let me ask you a question. Knowing what you know now about the power of personalized root cause approach, can you see yourself taking control and moving beyond traditional, conventional fertility advice to prepare yourself for pregnancy? And if the answer was yes, would you like me to virtually hold your hand through the entire process, helping you remove the overwhelm and the uncertainty from the picture? So, in my opinion, there are 2 options here. You could keep moving forward as usual, which is an okay answer, or you could commit to a proven, personalized root cause approach, and we could do it together. So I want to introduce my program, which is called Arise Fertility Blueprint, Functional Wellness for Driven or Busy Women. It is the most, I've checked, comprehensive functional wellness program of its kind, specifically designed to guide driven, busy women to optimize their hormones, overcome burnout, and prepare for a thriving pregnancy through personalized evidence-based strategies. So we're going to support your stress response system to make sure that it's working with you, not against you. We're going to make sure your hormones are balanced, obviously, optimizing those for fertility. We're going to make sure your gut healing is in tip-top shape. We want your immune system improved. We want to support autoimmune conditions here. And we want to make sure you're getting all the nutrients that you're taking in through your food. We're going to help you with detoxification and optimizing your cellular health, which lowers inflammation, make sure your eggs are of top quality, and give you back your vitality, your energy, your life. We're going to use personalized genetics to really customize your plan. This is such a unique piece of this program because nothing is cookie cutter. You will not have a protocol that I've given to somebody else in your inbox, period, end of story. And then the tools that you're going to learn in the program, you can utilize for the rest of your life so that you can show up and be the best version of yourself for your family and your future family. It includes a comprehensive initial consultation, which goes over your health history, your nutritional history, medications, supplements, all of your current health concerns. And then we meet monthly or every other week based on your needs and your desires to continue this plan. Timing is to fit your lifestyle. I do weekend and evening appointments, etc. And then in between appointments, you have access to me via text and voice support, basically unlimited. I say Monday through Friday, but I answer on the weekends as well. And then you get a very comprehensive approach to functional lab analysis. I feel like this is what truly sets this program apart because there's no guesswork. You're not wasting your time. We're not estimating anything about your health. You're going to get a full blood panel. You're going to get those organic acids tests that's going to tell us about the health of your DNA and your mitochondria. You're going to get hormone and adrenal testing to check your cortisol level, to check your estrogen, your progesterone. You're going to get a comprehensive stool test, which is going to tell me all about the health of your gut. Food sensitivity testing, so we can use it to remove things that might be causing inflammation. And we're going to get some functional genetic testing, which is what we use to optimize and customize your situation. When you become a client with me, you also have a couple of add-ons or bonuses. I order you a mobile phlebotomy. It's included, no extra charge, so that you can do testing in the comfort of your home or at work so that you never have to go into a lab, especially if you're afraid of lab draws. It really cuts down on test anxiety when you can do it at home with a loved one or your dog next to you. And then you're going to receive continuous progress tracking with a proprietary method that I have to monitor your symptoms and see what kind of progress you're making every month. I also send you a little welcome package with some curated items that are there to support you in your new fertility journey. You're also going to get some monthly surprises from me that really align with where we're at in your protocols so that you can use them at the moment you get them. You're also going to get a 60-minute one-on-one Reiki healing session as well, which is amazing and really going to help round out that sense of healing that you're going to get in the program. Okay, are you ready to take the next steps? If you are, you can book a discovery call with me and we can discuss your path to pregnancy, your questions, your concerns, all of the things. Okay, why you're here. If you can remember, you're feeling overwhelmed. Maybe you're curious about holistic wellness. Maybe you're frustrated but determined. Let's answer a couple of questions that I get a lot. So I've tried other programs before and they didn't work. How is this one different? Like I said, this one is comprehensive. You're not going to find a situation where we're going to test all of these things and you're going to get a truly custom approach and also one that fits in with your busy lifestyle. And that's the second part of this here is that I have a demanding schedule. How can I fit this into my life? I see clients on the weekends, in the evenings, in the mornings. We text at lunch. We talk in between patients that I have, etc. I really try to make this the most easy to follow program that is not going to hinder your busy professional life. And then, is this program really worth the investment? That's not a question I can answer. I, along with the clients that I've worked with who have experienced true healing from functional wellness, would say 100% this is worth it. But that's a question you have to sit with and just feel into your body about. If you have concerns about investing in anything, take a couple of days and just see what your intuition is telling you. A lot of times we get so stuck in our mind that we're not listening here or in our gut, and that's where the real answers are going to come from. Okay, so after we talk on a strategy call, if you feel like it's the right move for you because you sat through this webinar, and I hope you got some good pieces of information out of it, you can use the code THRIVE for $500 off your program. Okay, I'm going to take the screen off and we can go into a Q&A. Awesome. I think that feels complete. If anybody else has questions, my inbox is open. I thank you guys so much for sitting here with me. I hope that you got some value out of it. I tried to pack as much rounded advice as I could about non-traditional fertility tips. I hope you have a wonderful Tuesday, and we'll talk to you soon.